Hopefully, third time is a charm on this. We tried this 2 times before, but you all could not hear me. Let's see if this works now. I'm getting a thumbs up from Pitbulls. I'm getting some hearts. Does that mean you can hear me? Okay, Cynthia says yes. I just had to restart the phone. Option of last resort. So anyhow, here I was thinking I was talking to you and really was talking to myself, which isn't the worst thing in the world. But you couldn't hear it, but I was playing some David Garza as our opening music. Another great Texas musician. We had Jim Ward yesterday. And letting you know that we're going to have Andy Slavitt join us in just a few minutes. And he is one of the most important voices in healthcare at one of the most important moments for the American healthcare system. So really want to get his take on our response as a country to COVID-19 and coronavirus. Want to get his impressions of this $2 trillion relief package and what that means for our healthcare system, our infrastructure, medical equipment like ventilators, and the personal protective equipment that our doctors and nurses and frontline healthcare team need. All these great heroes who are out there saving the lives of our fellow Americans right now. Want to see what this bill will do for them and get his impression on that. Want to let you know that we have successfully completed 1 full week of the O'Rourke Homeschool for the Gifted. We had our last lesson today given by none other than Dr. Robert Gunn from the University of Texas at El Paso, covering the 1680 Pueblo Revolt. If you didn't get a chance to catch that at 2 p.m. Mountain Time earlier today, I think it is still archived on this channel. And if you, like Amy and I are trying to teach our kids without having the benefit of the world-class public school teachers upon whom we typically depend, having Dr. Gunn come in and give us a lesson was a great substitute. Our kids loved it. We had a chance to ask questions. If you joined us, you know that you were able to ask questions as well. Hope everyone is doing okay. Hope you are healthy. Hope you're well. Hope you're taking care of yourself and taking care of those in your life. Hope you're being kind to one another. My wife, Amy, is setting the example in this household. She's out of the house delivering some groceries to my mom, who lives on the west side of town. And a reminder that we should check in on our older relatives. Mom, if you're watching this, you're not that old, but maybe in that age range where you shouldn't be leaving the house at all. And so, thanks, Cynthia. Check on your older relatives, check on your older neighbors, do what you can for those in your life and be good to them right now. And that may also include just checking in on them. So shooting them a text, making a phone call, just letting them know that you are thinking about them and that you care. And then for those of us who've been doing this daily Instagram Live, though we have to be apart right now, doesn't mean we have to be alone, and we get to see each other and engage and interact and connect in some way right now. And for me, that has been very fulfilling, and hopefully this has been helpful to you with some of the guests that we've had on. We've had doctors from New York City tell us what they're seeing. We've had restaurant owners who've had to close their doors. We've had the inimitable Cynthia Cano and others, and right now we're about to have Andy Slavitt. So get your questions ready. I will, there's a little question icon at the bottom of your screen. If you hit that, enter a question, and the question's relevant, germane to the conversation that we're having right now, I will call upon you. Last thing, perhaps, big shout out to everyone on the front lines of this. So you saw the same pictures I've seen of healthcare workers, including nurses, or it may have been doctors in New York, wearing trash bags over their scrubs because the personal protective equipment that they had was insufficient for the patients that they were treating and their own care and safety. I've heard stories here in El Paso about not enough PPE for healthcare providers, and folks having to visit a patient and then take off their personal protective equipment, put it in a paper bag in that patient's room to reuse when they come back in and see that patient, because they have a limited amount of PPE and they don't want to wear the same PPE from one patient to a next. And we know that because we don't have enough tests, we don't know who has coronavirus or COVID-19 who's coming into these hospitals. And so we're putting our healthcare workers on the front line at great risk. And nonetheless, they show up each and every day, some of them working much longer shifts than they are typically working. And already they were working so hard. So our gratitude to them, to the janitors, to the cleaning staff, to everyone who's showing up in these hospitals to make sure that care can be delivered, as well as those stocking the shelves in our grocery stores, ringing up our purchases at the cash register, very often unable to keep that 6-foot distance from their customers. But they're doing that because they know it's going to be fundamental to saving the lives of their fellow human beings, the folks who live in their communities. We passed a very grim toll today in the United States, more than 100,000 cases. I believe that's more cases here in this country than in any other country on the face of the planet. I believe we have more than 1,500 confirmed deaths. And these are confirmed. This is what we know for sure because it's been tested. What we don't know are the number of people who have coronavirus or who have died of COVID-19 who are untested. So this is really more of an impression than it is anything else. Other two big pieces of news today, of course, the $2 trillion relief package signed by the President of the United States, passed by both the Senate and the House. Again, we're going to get Andy Slavitt's impressions on what this means to you, and what it means to our healthcare workers and to our healthcare infrastructure in this country. And the President finally invoked the Defense Production Act to compel General Motors to produce the ventilators, which before he was saying we had more than enough of, and his public health experts were saying that. I think he's now, everyone out there, forced him to wake up to the reality that we don't have enough. And people are going to die because we aren't prepared for this. And so our gratitude to the President for finally doing the right thing. I may not like the guy. I may think he's the worst president we've ever had, but I want him to be successful in this crisis. And so I'm grateful that he's responded to this very urgent need to produce ventilators in this country. So with that, let me bring on Andy Slavitt, who was I don't know what his official title was, if he was the acting or interim administrator for CMS, which is the Centers for Medicare and Medicaid under President Obama. I believe he came in after the disastrous launch of healthcare.gov and helped to fix that, stand it up, make sure that it worked. He was in part responsible for an annual budget that was more than $1 trillion. It's over 25% of the federal budget, covering over 130 million Americans. It made him, of course, a healthcare leader at the time, at the second term of the Obama administration, but also gave him the experience to help guide us in these very perilous times right now. And I know from talking with him that he is agnostic, nonpartisan when it comes to this. He'll work with Republicans, Democrats, independents, whoever, to make sure that we get this right. And so I really appreciate the way that he approaches this. He's the host of a new podcast called In the Bubble, and he's on Instagram. His handle is at Andy Slavitt, and I think he's relatively new to Instagram. So if you're not already following him on Twitter, you should follow him there, where you get daily or even hourly or even up-to-the-minute updates on what's going on in our response to coronavirus. But also follow him on Instagram, where I think he's going to produce the kinds of charts and visual information that helps us understand what's happening right now. So with that, I'm going to attempt to bring Andy Slavitt in. This does not always go smoothly, so bear with me. All right. There we go.
Hey,
Ladies and gentlemen, Andy Slavitt. Andy, how are you?
I'm good, Beto. How are you?
I'm good. We're hunkering down here in El Paso, running the homeschool, getting outside from time to time to walk the dog or run in the hills or take a hike with the kids. But everyone here is good. Where are you in the country right now?
I'm in Minnesota, and I want to announce that in our house we just invoked the Defense Production Act to get our kids to take out the garbage.
Did it work?
No, not yet. Not yet. It's a slow startup process. We're
Um,
hopeful.
so a lot of news today, and perhaps the biggest item is the $2 trillion relief package that was passed and signed. Can you give us your quick take on what that means for combating coronavirus, protecting frontline healthcare workers, and the health and well-being of 330 million Americans?
Sure. So if this is coronavirus bill 3 out of 10, it's a fantastic bill. If it's 3 out of 3, we should all know there's still more work to be done. But it was an incredible statement, I think, particularly from where it started, about who matters in this country. So at the beginning of this, it was mostly about business, and it ended up being about gig workers and people on Medicaid and low-income workers, and so giving people the assurance that they're going to have some money in their pockets to ride out a very uncertain time is extremely important. To send a signal from Congress that we have your back I saw a lot of that here. There's some things that weren't there that I think need to be, and we can talk about them, and I think they're already getting to work on them. But so, for example, we need to put more money in there to pay for people's health care. We put money in there for the healthcare system. I think that's a big relief because they need it. I think we have to do more for frontline healthcare workers. You pointed it out, Beto, in your earlier comments, and I couldn't agree with you more. The heroes are the people right now are fighting this battle on the front lines. And if we're thinking of this as a war, which is one way to look at it, these are our frontline troops, and we've sent our frontline troops into battle without really a great playbook. Some of it is circumstantial, some of it is lack of preparation. We've sent them out there without all the proper ammunition and the things that they need to win this. And we've done this in a way that is where they've got all kinds of other needs, childcare needs, food needs, making sure they don't get infected, and so forth. So I've called for a $5,000 a month payment to every frontline healthcare worker and first responder who is in the line of fire here to take care of a whole bunch of those needs. So I think if we go to the next bill, we're going to find that we're going to need to do that in order to keep these people out there. In the meantime, all of you and all of us have a role to play in supporting these folks. We're standing up a website to show appreciation for people. We've set up websites to provide where med students can provide childcare for frontline workers. So I'd say that where we need to go next is make sure that people have the assurity that they can stay employed and that they've got a holdover while they're at home. Because we do need people to make the sacrifice of being at home with their families a little bit more. It's a hard thing to ask of people, and Congress does need to support it.
Andy, let me ask you a question, and I'll use a story to introduce the question. A good friend of mine is a nurse here in El Paso, and she was telling me about how they haven't run out of this personal protective equipment, the gloves, the visors, the masks, the gowns that you need, not only to protect yourself, but to protect the other patients that you see. But they know that they're running low and that they have a finite supply, and so they're kind of rationing it. And she told me 3 separate stories of patients who came in. For example, a 12-year-old boy who had symptoms that made them think it was coronavirus, but he didn't meet any of the other factors until they learned his mother had recently traveled to one of these hotspots. Another guy who'd come in who was overdosing on prescription painkillers. Turns out he was showing symptoms of COVID-19, and they tested him. And another person who had a mass in her abdomen, they ended up doing an x-ray that caught how full her lungs were, the pneumonia that she had that had gone undiagnosed. They think that she has COVID-19. Now, because they're rationing the PPE, none of them were wearing the full face mask to take care of these 3 different patients, all of whom might have coronavirus, exposing all of those nurses. So one, I love your idea about making sure that a future stimulus bill accounts for what they are enduring, and the fact that so many of them are becoming ill. We just read a story in the New York Times today of a nurse in New York City who died. Some of his colleagues think it's because he didn't have PPE. In this relief bill, do you see anything that specifically addresses the severe shortage of PPE that we have in this country and has resulted in people manufacturing their own PPE for distribution to hospitals?
Right. Let me explain a little bit about the situation that's both with PPE, it's also tests, it's also ventilators. And it is, the way I would describe it is this: when you start late, when you're not prepared, and I think, look, we're not going to spend time beating up past mistakes because we are where we are, but it's, it's usually you play a little bit of catch up. The problem with a virus like this, which is that it grows exponentially, meaning every 3 days or 4 days, the numbers double. So we used to be seeing tens, then we saw hundreds, now we're seeing thousands and tens of thousands, and as you mentioned, we're now seeing hundreds of thousands, and that will become millions. The problem is that when you start out behind and something grows exponentially, it's like swimming after a speedboat that's moving. By the time you get to where you thought the speedboat was, it's much, much further ahead. So the only thing to really help these frontline workers and our healthcare system is if we're able to slow down the infection rate. And some excellent news is that in locations in the country that have implemented pretty strict controls, and I think we could talk about how that's it's not something we're usually doing in this country, right? So it's a cultural change. But the places that have done that, I'm getting real-time data feeds on average temperature levels, fever levels, which are great leading indicators. And there is an almost immediate benefit. And there's a lag because after someone gets sick, there's a 2-week lag before they would be hospitalized. But I can see where parts of the country are going to be significantly better than they would have been 2 weeks from now than they would otherwise. So a lot of times we're used to looking to you and politicians and people in Washington and our governors, and indeed everybody has a role to play. But what's kind of empowering about the crisis we're in now is the greatest impact that we're going to have on both the medical system and the number of people that we lose is our own actions. And if you don't mind, I know I've been talking for a little bit of time, I'll give you one example of this that I find fascinating. If you think about this exponential growth, it sounds scary, right? But if you look at it this way, if you have coronavirus, 80% of people who get coronavirus don't know where they got it from because it spreads with people that are asymptomatic. So we don't think we have it, but we might. And if I went out right now, if I had coronavirus and I infected somebody, the likelihood on average is that I would infect 2.3 people. That's the average. Now, if you play that out for 10 cycles, I infect 2.3 people, each of them infects 2.3 people. In 10 cycles, I've been responsible for infecting 41,000 people. And I know that doesn't sound good, right? It sounds terrible because the case fatality rate is going to be somewhere, let's just say 1%. Bill Gates thinks it could be between 1 and 3. Germany's saying 0.5. We don't really know, but let's just call it 1% to keep the math simple. That means that of those 41,000 people that were infected, that we would see, you'd see 400 or so people lose their lives. So if I am asked to stay home for 6 weeks, for 8 weeks, to miss some work, to miss some school, to miss some milestone events, to miss my friends, but in the process, I have a chance to save hundreds of people's lives, I think every American every American would do that. If you said, will you sacrifice this and save hundreds of people's lives potentially in a heartbeat? I think we would do it for 4 lives. You give me 4 people's moms or dads and tell me that if I just change my life, and I recognize it's hard for people, and I recognize that people are giving up a lot, that's what can happen. It's extremely empowering. So the government will do what it can do. It's chasing the speeding speedboat. The governors, many of them by and large, not all of them, but many of them are really hopping on these things. Mayors are, but a lot of this is up to us.
That's a really good point. And I I'm trying to be open-minded about those who are making the case that we should return to business as usual as quickly as possible. And in some cases, they cite the healthcare implications of this country going into a deep recession or depression. They say, folks are going to suffer and die if the economy completely bottoms out. And I want to make sure that I'm open to that argument, understand where it's coming from, and acknowledge, as you just did, a lot of people are out of work right now, massive unemployment filings. People are really struggling. I was at the food bank volunteering yesterday with our family. There was a line, Andy, literally 2 miles long of people trying to get in. So people are suffering. But when I think that through and I take each of these arguments to their logical conclusions, if we were to reopen the economy, people were to go back to work, I can only imagine the economic devastation as hospitals became overwhelmed, as people died, as we dealt with the true brutal brunt of this pandemic in a way that we haven't yet seen in the United States, maybe only are beginning to see. So tell me if I'm wrong in this, but I think what we're asking people to do now by staying home and closing their businesses, as difficult as that is for them to do, is to make this temporary economic sacrifice so that we can save lives, maybe in the hundreds of thousands, and so that after this is over, we can get this economy back up and going again, and then really begin to move forward without having the kind of death and devastation that we would if we didn't socially distance ourselves and shelter in place as our government's asking. Is that the way that you see it?
That's really well said. And look, it's hard. I mean, and if you were president, or I should say, when you're president, someday in the future, Beto, if you were on my ballot here in Minnesota, you'd feel the frustration and the struggle, because there's no easy answer, and you'd feel like you want to put aside the personal characteristics of this president, who is motivated by quick answers and things that make him look good, and sometimes things that aren't always science driven. But I understand that what he's saying appeals to a lot of people, because they don't see this around them. They're feeling personal pain. They're not sure they're at risk, and so there is I think we both understand why that's so tempting. The problem is with just so much capacity, let alone the material goods that protect people and the ventilators and so forth. If we did that, this early in the virus, a la Easter Sunday massacre, we would overrun this healthcare system. And if we overrun the healthcare system now, we're not giving our scientists a chance to catch up. We have great scientists. Let's just give them a chance to get ahead of this. Let us get a chance to catch up to this, and I'm confident they will. Let's give our care providers, the nurses and doctors that we know and we love, and many of them in our family, the chance to pace this thing out. Because if we do that, when we come back up, and I know a little bit about the economy, as do you, the stock market, the economy, they're not looking for a quick fix unless that quick fix is a real fix. And doing that this early in the virus, we've seen from all over the world, we will quickly be shutting it back down again, and I think we'd end up in worse shape.
One of the things that I think makes this so hard is, though the logic is really clear, if we care about those frontline healthcare workers, and we're going to stay at home so that we don't put them at greater risk and put further stress on an already stretched thin healthcare system, but there's no positive reinforcement for doing the right thing, right? So if you do if a community does the right thing, and everyone stays at home, then nothing happens.
Right.
And that's a really hard thing for us to respond to. But we want nothing to happen at this point. We don't want there to be the news that we have mass infections, mass deaths, and a massive overload on our healthcare system. So I think messages like yours, reiterating the wisdom of staying at home, and then connecting it to the sacrifice that we see going on day in and day out in the healthcare system, hopefully that is compelling for people. because literally it's going to save lives. Andy, do you have time to take some questions from some of our viewers?
I do. I think what you're saying is so true. It's a lot like when you talk, like thousands of people press the heart button, and when I talk, nobody does. So it gives you the incentive to talk, and it gives me the incentive to listen. It's the exact same thing. So I was hoping that would get a couple hearts going, but apparently not. The thing that is, it's so true is as humans, we're used to the experience of seeing the benefit of our action, some reinforcement. And here, because we can't teleport you to the middle of New York City or New Orleans or Miami where things are getting really bad, if you look in your city or your town or your state and things are getting better, that's because of you. You are doing that. And
that's right. Everyone who's staying home, you're making that happen. So, Andy, first question from somebody who's viewing. This is from Jack. Is the curve flattening in different states? So we know, or we have an impression of how bad it is in New York, how bad it is in Louisiana, how bad it's been in Washington State. Are there some states that are doing the right thing or have been fortunate, and the curve is flattening there?
Absolutely. I was on the phone with someone in Seattle today, basically every day the last few days, and the curve is flattening. They lived through the horror of all of those nursing home deaths. So you don't have to tell anybody in Seattle that this is real. And so they took action and it started to flatten. We did an analysis of a whole bunch of areas to look at what happens when a state governor declares some sort of tighter restrictions, either closing the bars and restaurants or the sort of stay-at-home orders. And it turns out that the curve doesn't just improve, it takes a sharp dive. Now, there's a lag because there's 5 days when people are asymptomatic, then 2 weeks before they get hospitalized. And so you end up not seeing it right away. But I can tell you 2 weeks from now, things are getting better. Even in New York, they went from doubling cases every 2 days to doubling cases every 4.5 days. Still growing exponentially. So if you in a vacuum, that would be terrible. But that's really reinforcing.
So Jack asked another great question. Are we seeing the rising numbers because more tests are being administered, or are more people being infected? I've got to guess it's both, but what's your opinion? Both?
Both, yeah. So we've gone from 10,000 tests a week to now about 200,000 tests a week, which is, we need to be, my estimation is we need to be at about 200,000 tests a day. So we're still to be where I think South Korea is, which is, having enough intelligence on where the virus is, who's connected to it, and all of that. So we are definitely seeing some catch up, and so the fact that right now our curve looks worse than Italy, and by curve I mean the rate at which the number of cases are being reported. Some of that is a function of that. But we're still even if you took that out, I suspect we were still pretty close to where Italy and Spain are in terms of new cases.
Andy, I pinned a question from Nicole asking, should we have a national quarantine? And maybe, I don't know what the term of art is, but maybe it's shelter in place. I have been calling, as have many others, for a statewide shelter in place in Texas. We have one in El Paso, we have one in Dallas County, we have them in Harris, we have them in all the major metro counties. But because we don't have testing and we don't have contact tracing in Texas, we don't know how quickly this is spreading. The smartest thing, in my opinion, for our public health is to have a statewide shelter in place. Nicole asked, should we have a national shelter in place? Is it time for that?
So, I think the answer is a little bit of yes and no. And here's what I mean by that. We epidemiologists know that asking people to shelter in place for too long, if the virus isn't yet spreading at an increased rapid rate in their community, people get frustrated and then after 2 weeks, they start to ignore what they've been told because they believe they've been lied to. This is what some of the studies have shown. So you have to be a little bit careful and not shut things down immediately. There are hospitals in Ohio, parts of Ohio, that are still only a third occupancy. They're getting ready, but they're not there. So I think it's a really careful art. And if we had to be, if we had to do one or the other blunt on-off switch, I think we would. And if we trusted all the governors to do the right things, I think we would say, okay, let's make sure that we have a trigger. And every governor should be responsible for saying, and every mayor should be responsible for saying, here's the trigger that allows us to go from A to B to C to D. I know if we were in the Obama administration, we would be making it very, very clear that, and the big test is when you see rising number of community cases. And when you see a rising number of community cases, then it becomes time to do that. Closing bars and restaurants, very, very effective. One of the most effective things that's done. And if you've got two choices. We can do that now and then slowly begin to open up as the infection fades in our communities. Or we can kind of do it herky-jerky, and I think we should do it now.
In your opinion, how did the U.S. surpass China, Italy in cases? What's different here? You mentioned the difference between the United States and South Korea. South Korea very vigorously testing. China, I think, maybe unique to the world. If I were walking home from a restaurant and somebody on the street corner, public health worker, read my temperature, I had a temperature, they would force me to get tested for COVID-19. If I tested positive, I would not be allowed to go home. I'd be sent to a dormitory or a hospital. So they were almost brutal in isolating the patients, but it turned out to be very effective. Does that explain, in a country with a much larger population, a much smaller number of cases in the United States, or is there something else that we're missing here?
So you got it. I mean, there are a few things. One is to direct answer the question, we're a bigger country. So we don't have more cases on a per 100,000 basis. We have but we are leading in terms of size, and then some of our cities sadly are leading in growth rate. New Orleans is the biggest hotspot in the world. The highest growth rate of any spot in the world is New Orleans. Yeah, I would say there's a couple of things that work for us and a couple of things that work against us when you think about our culture. And you're such an excellent person at tapping into the mood of the country, Beto, that you might have some perspectives on this. But part of us, right, part of who we are is we're fiercely independent. We're somewhat distrustful of government. And we're kind of used to being able to do what we want when we want it. That's a little bit about the nature of being an American, is in the quote unquote freedoms that we think we're allowed. In a situation like this, a public health crisis, some of that can bite back at you. Now, obviously, there's reasons why that's good for this country. On the other hand, we are as innovative and fast-moving and creative as any country in the world when we want to be. And so it's a lot to ask people to have faith in elected officials. It's a lot to ask to have people to sacrifice seeing their friends, going to bars, seeing their family, visiting. Hell, I'd love to be visiting my mom in Chicago right now, but we're FaceTiming and we're making up online games to do together. So all of those things are tough to do. And in South Korea, they did those things. Now, I will tell you, they were also much more prepared. They had their first case the same day we had our first case. They were rolling out tests, rolling out drive-through kits, rolling out contract tracing right away. We still haven't done that. And again, as I said earlier, it's just not a matter of being late. It's a matter of being late and chasing an exponential growth curve.
Two last questions for you, and then we'll let you go. This is a question that I've seen raised by members of Congress, debated literally at the presidential debates. would a single payer healthcare system have better prepared this country for coronavirus or other pandemics?
Billions of dollars of investment in our public health system would have been the number one thing, and any form of universal coverage. And look, there's 4 or 5 ways to do universal coverage. In my view, none of them are perfect. All of them are better than what we have today. And where we are today is a hell of a lot better than we were before the ACA. So I'm all for any form of universal coverage. I think that would help. But, there's also only if you make the right types of investments. And there have been people who've been kicking and screaming for years under both administrations. This isn't a Republican-Democrat thing, that we've been underinvesting and underpreparing for a global pandemic. I think the Obama administration learned a lesson and tried to leave the Trump administration tools to help, and they tore those down, and that's unfortunate. But I also wouldn't say that would have been enough. So more investment in our healthcare infrastructure, making sure that everybody has access to healthcare, those kind of feel like basics, right?
Yeah.
Those kind of feel like when we come out of this, I'm not to say we're not going to still be fighting those fights, but we shouldn't be fighting those fights because those are not political things. Being able to afford to take care of your family if something happens is the least political idea that I can think of.
Last question I want you to respond to. This is from DPP22. They say, I really don't understand how this ends other than having herd immunity. How long would that take? There was another question about how long will it take to come up with a vaccine or potentially a cure. So can you, and I know this isn't anything that you're going to know for sure, but what are some scenarios? How does this play out longer term?
It's a great question. It's a reasonable question. It's the right question. And while this is novel, we know more every day. And the more we know, the more we can fix, which is why buying us time is so important. But let me give a little bit of what the path could look like, because I think all the experts I talk to, and I don't hold myself out as an expert, but I do hold myself out as someone who's probably talked to as many epidemiologists, scientists, homeland security people, defense people, clinicians, governors as much as anybody. I've been doing this full time for the last week to 10 days. So let's put it in let's call it 4 phases. Phase 1 is the phase that we're in today, and we should be in, which is really strong social isolation measures. What that will do is, if we can push the R-naught, everybody knows what the R-naught is, just comment if you don't, but it's essentially how many people get infected per person. As soon as the R-naught goes below 1, we're winning. R-naught of this, if we were all out doing our normal stuff, could be 4. R-naught right now is in the sort of 2+ range. R-naught in some parts of Europe is 3. But if we get that down below 1, we are winning, because the virus has no place to go. So step 1 is get that R-naught as close as possible. Wuhan got its R-naught down to 1.25, and which is about what it is for the flu. We should be able to do that. Once we do that and we start to see, and look, it's going to be an ugly period, and I just think we all know this, and we need to warn ourselves through this. We're going to see numbers that are going to be hard to believe, and we're going to see images on TV that we're only used to seeing in other countries. It's going to be traumatic. But when we get through this phase, the next phase, presuming that we've now built up adequate testing, we've got antibody testing, so we can tell who's built up immunities. We've got antivirals. We will be able to, and let me call it 6-8 weeks from now. Bill Gates says 6 to 10, but I think we should think about that realistically. Then we'll be in a mode where we can begin to open up businesses. We can begin to go back to work, but we'll still want to keep our 6 feet distance. We'll still be washing hands like crazy. I'm not sure we'll ever be shaking hands again, to be honest. I think we're gonna kind of, that might become one of those things people look back on centuries from now and we're like, people actually touched hands when they got together. Why did they do that? But we'll go through that period, and I think we'll go through slight waves. It'll be a little bit better in the summer because the R naught will go down in the summer because the virus doesn't like ultraviolet light. It'll go back up in the fall. Different regions will be different, but I'll call it a managing phase. Third phase is beginning of next year sometime, we will know whether we have a working vaccine. And I have a lot of confidence that we will. Now, the vaccine won't be perfect. It won't necessarily help everybody. And it'll take some time to produce once we have it. So it's not like a year from now the vaccine's going to be rolling out. The vaccine, it could take months to do that. By that time, we're going to be super efficient at this. We're going to be running fast. We're going to have antivirals. We're going to know who's had it. But when that vaccine comes, the combination of vaccine and herd immunity will mean that most of us will not only be safe if we get this, but most of us will be safe. And that's the third phase. And then let me give you the fourth phase, which is, okay, what does it look like after that? What it probably looks like after that is that we have this bug that's kind of like the flu. It's a more deadly flu, and it's a more contagious flu that kind of goes around the world seasonally. And we have vaccines every year. And during those periods of time, we will really want to protect our elders, people with chronic conditions. And you might see a system that was kind of like we developed after 9/11, where you've got green, yellow, red days or months or periods where there's some contagion out there, but we're living with it. We're chasing it. We're not losing a lot of lives to it, but it probably is part of our life. Maybe new strains come along, so new vaccines have to come along. So anyway, I can't predict the future. You can come play this some period of time and laugh at how wrong I was about this. But if I were going to give people a path forward and reason to hope, I'd say there's tons of reason to hope. And right now we're in the hardest part.
Yeah, that's so helpful with the disclaimer that we don't know for sure, but it's so helpful to think about this in phases. Also to prepare ourselves for things getting worse in the near term, which undoubtedly they will, but using that as a spur to get people to stay at home. And also to your first point when we began talking today, getting the government to go beyond this $2 trillion package. It is not mission accomplished. It's not as though the government is done with their responsibility. Until we have the PPE, the ventilators, all the funding necessary to pursue the vaccine or the cures or whatever we need to make people safe against this, the job is not done. And unlike any other form of organization, government uniquely has a capacity to marshal these resources. We saw it today with the Defense Production Act asking GM or mandating GM to produce these ventilators. So let's keep the pressure up, but also keep the faith up. And I've got to tell you, Andy, this is the most informative half hour I've had on this subject. I follow you on Twitter to kind of get a minute by minute read of what's happening, but it's so nice to be able to talk with you, hear you answer people's questions, and also give us some hope because you're giving us facts, which is a contrast to some of the other sources of information we get from leaders right now. So thank you so much. We'll let you get back to your family and hope that we get a chance to talk to you again. A reminder that Andy Slavitt has a podcast called In the Bubble. And if you want to follow him on Instagram, it's at Andy Slavitt with 2 T's. And that's how you follow him.
That's so nice. Someone might be my 1,000th follower out there since I just started this thing. If I could say one more thing, Beto.
Yeah.
Thank you for having me on, for talking about this so intelligently, for not focusing on the politics of the moment. We have to steer from where we are, not where we wish we were. And for everyone who's following this and for the people you touch and talk to every day, there's an enormous opportunity to share a little joy and a little hopefulness and a little support for people who need it. I know you're all doing that. As opposed to sharing anxiety or fear. We don't know what's going to happen, but we will get through this. And there are people who are going to need to hear some level of support. And what's exciting to me in some respects is I'm 53 years old. I've never been asked to sacrifice anything in my life, really. I didn't go through the World War II generation. And so if I can do something that at the end of this, I will look back on, I think we're all going to look back and just, people will ask us, what did you do during this time? And so I think it's an enormous time to share our generosity. You're such a great model of that for everyone. And we should just try to inspire each other, and then we can get through it.
It's great. I love that message. And let's find joy where we can. Let's be hopeful. And let's take care of ourselves and take care of one another and be good to each other. And I think there are a lot of ways to do that. So thank you again so much. And I hope we get to talk to you again in the coming weeks to get another update from you. And you were so helpful in answering questions. So thank you. Thank you. Thank you.
Anytime.
All right. Adios.
Adios.
All right, folks, that was Andy Slavitt, and want to thank him again for joining us and answering my questions and answering your questions. I'm so glad that some of you owned up to not knowing what an R-naught was. I didn't know what it was, but I was embarrassed to admit that first, and so some of you gave me cover. But understanding the R-naught right now and this number that we have to follow, we want it below 1. That should be something that we're tracking, along with the number of infections, the number of deaths, other metrics that help us understand what's happening in this country right now and what's happening around the world. Super, super helpful. And I loved his closing message about joy and finding ways to connect, which is part of why we're doing this Instagram Live on a daily basis, or at least a week daily basis, to get interesting, informative guidance from people like Andy Slavitt and from Christina Sanders-Manis, who was a frontline New York City physician who we talked with maybe a week ago, but also just to connect and to make sure that we're able to share some of that joy. Cynthia, I am going to try to bring you in. I want to get your take on this, and then we'll wrap up. Oh, you know what? I saw someone else on this that I'm going to try to get in first. But I don't know if she's going to respond. Hey, I'm loving all the comments. There's a lot there. I mean, hey, there you are. I was gonna, Cynthia's our producer on the show, and I was gonna ask her how we did, and then I saw that Amy O'Rourke is watching, which made me so happy. Molly,
what we're doing.
What are you up to? Oh, cleaning the fish tank. How's it going?
It's grody. It is disgusting.
Even though I got you the big fish tank cleaner pump.
The pump is awesome.
Can you show us the pump?
Yeah.
Well, let's see. What you do is...
Hold on. I'm awkwardly holding this. Okay, hold on. Okay, here we go.
So you put it in the water.
We just had to get all of these fish out. There's too many fish. So if anybody would like a fish,
It's
some
because our
fish.
fish had babies and we can't do anything about it right now. Okay, ready? So you pump.
So she's pumping the water out of the fish tank into the bucket.
Gotcha.
And then it comes after a second, it goes really fast.
The stuff we have time for when we're not in school and not at work.
And there it goes.
Awesome.
We just have to make sure it doesn't overflow in the bucket.
What did you guys think of Slavitt?
He was pretty awesome.
Yeah, I agree. He's got such a good way of breaking down such complex, confusing stuff in a way that I can understand.
Yeah. Very,
Oh,
wait, hold on. Hold on.
Okay, now we empty it. So we do the opposite thing. So we put this into the dirty water. And we put this...
Or I can just pour, let me just pour it.
No, wait, I want to do this. Can you help me? So then you put this into the bathtub. And then you pump, 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 pump.
All right.
And it's going.
All right, that's probably more than you wanted to see, Beto.
No, it's really good. It's more than I wanted to do. So I'm glad that you guys are
I was
doing
gonna
it.
say you're happy you're down there doing the live stream versus up here doing the tank.
Totally.
You probably can smell it from down there, actually.
No.
No, but I know what that smells like. Okay, I'm
Okay.
gonna let you guys go. I'm gonna be up in just a second. I'm now gonna bring in our remote producer, Cano. There she is. Okay, everyone. Hope you have a great weekend. Cynthia,
Beto,
can
how
I tell
are
you
you?
something?
What's that?
Can I tell you something?
Yeah.
So it's echoing. You have maybe your volume up really high, or
Turn that down.
turn that down.
All right. Is that better?
Can you hear what I'm saying?
I can.
Okay. You always have the volume up really high on your phone. I've noticed that when we're in meetings and your ringer goes off, or you get an alert that you got an email or somebody liked your Instagram post, very loud.
Can I say something, Beto? So
Yeah.
that is one of your biggest pet peeves is when my phone makes a ton of noise. I know that bothers you, and I try not to do it. And so I don't know, maybe that's one of the things that you'll remember me by.
So one, since you're the executive producer of this Instagram live, two things actually. One, I want to get your take on Andy. I'm still getting some feedback from your phone, Cynthia. And what? Say it. Just say it out loud, Cynthia. Don't make that face. Just say it.
It didn't happen yesterday. I don't know why it's making
Now it's not
that.
happening. Oh, now it is kind of happening. Okay, two things.
Better?
So I'll be brief, let you talk, then we'll shut it down. One, want to know what you thought of Andy Slavitt. Two,
He was awesome. I feel like I learned a lot, and I think he had a way. He really had a great explanation on things that made it easy to understand. So I thought he did a really, really good job.
Laura says that you've got the phone against the table and it's echoing from there.
So I'm holding it in my hand. I'll move this way.
That
No, better?
It's still doing it. Oh well. Hey, so last thing, there was a comment, and yes, I'm reading your comments. There was a comment that we shouldn't be doing this Instagram live at the same time the president is doing his daily press conference.
Is it okay? I didn't realize it was at the same time.
No, but here's what I think. I think that's great, because here you have the president who is not trustworthy, who's routinely lying to the American people about everything that he talks about, including coronavirus and COVID-19. This is the guy who said we should all go into the churches at Easter and get together, even though we would be spreading coronavirus to one another. This is the guy who said, like magic, this is going to disappear. This is a guy who thought this was, the concern about this was a hoax on the part of Democrats. This is a guy who has to be routinely corrected by the public health officials with whom he works. So what if we do this at the same time that the president is doing this, and have people like Andy Slavitt on who are telling the truth, who deal in facts, who respond to people's questions, and make sure that we have the information we need to make the right decisions in our lives. So I kind of like, if that's in fact what's going on, I like doing that. And here's the other thing. Hats off to every news organization that is refusing to carry the president's press conferences live, because they are so full of bullshit and misinformation and lies that are dangerous and could kill people, and functionally just serve as re-election commercials for the Trump 2020 campaign. There's no ability to check what he's saying in real time. And so what I've seen is some news organizations are no longer carrying them live, and instead are doing the necessary analysis and fact checking to determine whether what the president said was actually true or not. Horrible that we're in this kind of situation, but we are. So what if this and others who are doing this, there's probably hundreds of thousands of people who are streaming like we are around the country, you purposefully choose this time when the president's giving his press conference?
I think that makes sense. And I think also if folks can make some recommendations of people that they think would be good guests to have on, would love to hear them. if they want to reach out to me, post something on our feed right now, I will do my best to try to make sure we have a good group on that are able to answer the questions that we need answered.
Can you see that picture?
I can.
Isn't that great?
Yeah.
That's the poppies blooming in El Paso on the northeast part of the mountain right now. I'm going to leave you with that image, Cynthia, and thanks for setting up the interview with Andy. Our thanks to Andy Slavitt, to everybody who asked really good questions. You know, Jack should be our co-host on this. I don't know if you saw the great questions Jack asked, but they were really good, and Nicole and others. Everybody who tuned in. I don't know when we'll next be on. I don't know if we're doing this tomorrow or Sunday, but definitely Monday we'll be back, and would love to see everybody. And Cynthia, any good guests coming up that you want to tell us about?
We have an infectious disease specialist from Baylor coming on Tuesday, and she has been doing a lot of research on what's going on right now and is going to provide us with a great update. I think we might be able to get Jim Ward on, a local businessman. I know
yes, have you talked to him?
I was going to do that this weekend, and so I'll touch base with him, and hopefully we can bring him on. And then I think we might have Gina on, who we met in Nevada.
Yeah,
and so,
Gina and Summer.
Right.
Okay,
Gina
good.
and Summer also come on. So those are some of the folks that are coming up next week. And, you know, somebody made a comment I saw right now, Congressman Will Hurd. I think he would also might be somebody great to bring on if we can. So
great.
Stay tuned.
Stay tuned. And last image I'm going to leave you all with, this is a picture of the El Pasoans Fighting Hunger Food Bank, where I was yesterday with Amy and our family and dozens of other volunteers. If you can volunteer at a food bank, please take the time to do that. They'll give you gloves. They'll make sure that you wash your hands. They'll keep you 6 feet apart from everybody else. And it's something that's needed in our communities right now. So please, if you're in the El Paso area, go to El Pasoans Fighting Hunger. If you are in Texas, go to Feeding Texas. If you are somewhere else in the U.S., go to Feeding America. Also go to those resources if you need food right now, and make sure that you get the nutrition and calories for you and your family. All right, Cynthia, have a great day. Have a great weekend. Thanks for everyone who participated in today's conversation, and we'll see you all very soon.
Bye.
Bye-bye.